Gentleman yields back, and I recognize Representative Fletcher from Texas for her 5 minutes of questions.
Well, thank you, Madam Chair, and thank you to all the witnesses for testifying today. I do think that the opportunities as well as the concerns about AI are important for our committee and this subcommittee to consider and for the Congress to act on, and I appreciate your testimony today. But like my colleagues, I am deeply concerned about the context in which we're having this hearing. And this conversation we really do have to have in the context of 2025, both the rapid advancements in AI and the massive reductions in access to healthcare that the Trump administration has set in motion with a rubber stamp from this Congress. Since January, the administration has dismantled our government agencies and public health infrastructure, and this Congress hasn't just ignored it, although it has enabled it. This committee is included in that problem. From the mass layoffs to the firing of the Vaccine Advisory Board to the Twitter firing, non-firing of the CDC director and the mass resignations at the CDC just last week, to the gutting of the Substance Abuse and Mental Health Agency. This administration has weakened our public health agencies, and at the same time, it has demanded that Congress reduce access to care and efforts to make care affordable for all Americans. And this committee has done so. We've sat through those markups and those votes. This committee has done no oversight on the issues I just identified, and has held hearings and markups reauthorizing programs that the administration is gutting. And so while there is an important opportunity here, and I really appreciate your testimony and your being here to help inform us in this work, it's really important to know that it's happening in this environment and that this committee and this Congress need to get serious about the things that you all are sharing with us. And with that said, with kind of the time that I have, Dr. Mello, I do want to follow up on your exchange with Ranking Member Pallone about prior authorization and on some of the issues we just heard about as well with Mr. Toy in the last questions. I represent a lot of physicians in Houston, Texas, and they and their patients tell me that prior authorization slows down access to appropriate care by forcing physicians to spend time, as we've heard about, and also just leading to wasted time, worse health outcomes. It's documented, and for years there's been bipartisan agreement, I think, in Congress that the Medicare Advantage prior authorization practices need to be reformed. We also heard about that from Dr. Joyce. And particularly when it comes to the use of AI to deny claims. And despite the consensus, as you all know, the Trump administration announced the CMS pilot program, the Wasteful and Inappropriate Service Reduction, WISER model, that implements prior authorization for a list of services for people enrolled in traditional Medicare in 6 states, including my home state of Texas, as well as Arizona, New Jersey, Ohio, Oklahoma, and Washington. And the way CMS plans on carrying out this pilot is to contract with companies that will use AI to determine whether a procedure will be covered. CMS has said that the ultimate decision-making authority will be a clinician, but it has also included financial incentives for these AI companies to reduce spending, and one way they can reduce spending is by denying care. And so they're going to receive a percentage of the savings from denying care to patients. And so instead of improving these prior authorization policies in Medicare Advantage that have been under scrutiny for years for denying critical medical care, the administration's really doubling down, as far as I can tell, and creating the same problems for the traditional Medicare program. And so, Dr. Mello, in your view, is current federal law sufficient to regulate the use of AI in prior authorization?
No, it is not.
Do you want to expand on that a little bit, on how and what specific things that we could do on this committee and in Congress with federal legislation to address and ensure that AI used in coverage determinations doesn't deny or delay medically necessary care?
Well, I want to acknowledge that CMS did some very good work on the regs and the final rule for use of PA in Medicare Advantage plans. Much better. There are 2 gaps. One is that it specifies that there needs to be human review before a denial is issued. No one argues about that. Everybody does that. But the question of what does that mean? There are no standards for what that means. And in my opinion, when you present a human with a packaged up, predetermined denial, nicely curated with all the reasons, that human approaches the decision in a very different way than they would with a fresh pair of eyes in a non-curated file. So it should mean that human isn't primed by a computer to validate the AI decision. And the second gap is commercial plans. So aside people who are in employer-sponsored plans, commercial insurance plans who are non-Medicare, don't have any of these protections that Medicare Advantage plans do, and those plans have little or no reporting obligations, particularly for ERISA plans. So finding ways to penetrate the commercial market and understand what they are doing, where AI is being used to get to yes faster, and where it's problematic, that requires additional action.
Great. Well, thank you so much. I've gone over my time. I have one more question for you. I'll submit for the record, and with that, I will yield back.